Today we will be presenting about different types of mood disorder. The objective of our project is to define what is mood disorder, main types of mood disorder, causes and symptoms of mood disorder, and how to manage it. Used to broadly describe all types of mood disorder. The main types of mood disorders are depression, bipolar disorder, and anxiety disorder. The symptoms can be vary by individual and can range from mild to severe. Firstly, depression is characterized by feelings of extreme sadness and hopelessness. Usually, victims of depression will show less interest in usual activities and feeling sad. They may experience this by the severity of depression and the presence of mania, as well as by how often mood swings occurs. These changes in mood swing can last for hours, days, weeks, or even months. Based on studies, bipolar disorder tends to run in families and is found among all races, ethnic groups, and social classes. Bipolar disorder usually begins in late adolescence. Usually, anxiety disorder involves more than temporary worry or fear. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. There are several different types of anxiety disorder, which includes social anxiety, panic disorder, and phobia-related disorder. The causes of mood disorder. It is difficult to pinpoint because scientists are still studying the causes of mood disorder. According to theory, mood disorder is thought to be caused by a combination of environmental, psychological, biological, and genetic factors. Not only that, some physical health conditions such as thyroid problems and medication can cause mood disorder symptoms. Thus, physical health examination is helpful in the evaluation of possible mood disorders.
So in terms of the symptoms and the course of these mood disorders, for both major depressive disorder as well as the bipolar disorders, the symptoms need to represent a significant change in the mood of that person, and they need to interfere with daily functioning. Now, with major depressive disorder, there has to be the absence of either manic or hypomanic episodes. Otherwise, it would be considered part of a bipolar disorder. And so with bipolar disorder, there has to be at least one major depressive episode. Again, if that is type 1. In terms of major depressive disorder, there has to be at least 5 of the following symptoms in a 2-week period. Depressive mood, anhedonia, which is the lack of interest in previously pleasurable activities, weight loss, altered sleep, psychomotor retardation, which is essentially referring to abnormally slowed or reduced movements or speech, fatigue, feelings of worthlessness and guilt, impaired cognition, or thoughts of death and suicide. So at least 5 of those have to be present in a 2-week period in order for major depressive disorder to be diagnosed. Now, in terms of bipolar disorder, at least 3 of the following have to be present lasting a minimum of 1 week. So grandiosity is essentially referring to an inflated sense of self-esteem or importance. So the individual has unrealistic beliefs about things like their intelligence or their abilities. There's also a minimal need for sleep. They can be excessively talkative, have racing thoughts or flight of ideas, and that essentially refers to rapidly changing and disconnected thoughts. They can be highly distractible, have psychomotor agitation, so there's increased physical movements that are purposeless and reflective of an agitated or an anxious state. So there's a lot of things like fidgeting and pacing, as well as impulsivity and poor judgment. And so type 1 includes mania, whereas type 2 includes hypomania. And they're differentiated by the severity and the intensity of those manic symptoms. Now, in terms of the major depressive disorder, after age 13, there's significantly more women who will develop major depressive disorder. And there's also an increased risk when physical illness or pain are impairing a person's function. In terms of the bipolar disorders, there's certainly a much higher rate of suicide, more than any of the other psychiatric conditions. In fact, the rate of suicide is 4 times that compared to depression and 15 times higher than the general population.
People who suffer from anxiety, also known as generalized anxiety disorder or GAD, are in a constant battle with their mind. The negative mind frame associated with anxiety can develop from stressful events such as a presentation due at work. However, even after the stressful event, a person with anxiety continues to have a constant negative feeling, and in some cases the negativity can spiral out of control. Anxiety can affect a person's relationship, sociability, and overall well-being. If anxiety is not treated, then it can worsen, and everyday activities like going to work, speaking to friends, and even going to the gym can feel impossible to do. Anxiety can be brought on by traumatic events or stressful experiences. However, genetics, brain chemistry, environment, and personality factors also play a big part. A person suffering from anxiety can experience extreme muscle tension, restlessness, headaches, nausea, and a difficulty in concentrating, breathing, and sleeping, which can lead to chronic fatigue. Anxiety disorders can affect people in many different ways. In some cases, the problems they may face may feel small to the outside world. The person may also realize this but still feel helpless. Trying to help a person with anxiety by saying just to get over it or move past it will only make the situation worse.
Management of mood disorder. Most of the mood disorder can be diagnosed through both physical examinations and mental health evaluation. However, most of the individuals are reluctant to seek help for mood disorders due to the social stigma associated with them. Because of this, many go undiagnosed and approximately only 20% of those diagnosed receive treatment. There are 3 different types of treatments of mood disorder. First is depression treatment, then bipolar disorder treatment, and finally, anxiety treatment. Depression treatment. Even the most severe depression cases can be treated. The earlier the treatment can begin, the more effective it is. Depression is usually treated with medications, psychotherapy, or the combination of both. Antidepressants are medicines that treat depression. It may help improve the way your brain uses certain chemicals that control mood or stress. However, you need to try several different antidepressant medicines before finding the one that improves one's symptoms and has manageable side effects. Once taking antidepressants is started, one should not stop taking them without the help of a doctor. Sometimes people taking antidepressants feel better and then stop taking the medications on their own, and the depression returns. When you and your doctor have decided it is time to stop the medication, usually after a course of 6 to 12 months, the doctor will help you slowly and safely decrease your dose. Stopping them abruptly can cause withdrawal symptoms. Bipolar disorder treatment. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some people may have lingering symptoms. Long-term continuous treatment helps to control those symptoms. Psychotherapy can be an effective treatment for bipolar disorder. It can provide support, education, and guidance to people with bipolar disorder and their families. Some psychotherapy treatment used to treat bipolar disorder include cognitive behavioral therapy, also known as CBT, family-focused therapy, interpersonal and social rhythm therapy, and finally, psychoeducation. Sleep medication is also widely used to treat people with bipolar disorder who have trouble sleeping, usually find that treatment is helpful. However, if sleepiness does not improve, a doctor may suggest a change in medications. If the problem continues, the doctor may prescribe sedatives or other sleep medications. Anxiety treatment. For anxiety disorder, there are many treatment options, but according to researchers, it is found that combination of good self-help information, support, and personal coaching or therapy are the most effective treatment for anxiety disorder. Some of the experienced coaches or therapists had personally experienced and successfully overcome anxiety disorder and anxiety symptoms means not only do they understand one's struggle and how anxiety symptoms feel and can impact a person's life, but that they also know how to treat anxiety and its symptoms. This personal experience is a valuable asset in the anxiety disorder recovery process, including treating symptoms. According to researchers, there is no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of symptoms if you are anxious. Like keep help early, stay active, and finally avoid alcohol or drug use. To generalize this, everyone experiences emotional ups and downs. Life is full of situations that leads to moodiness, though a healthy individual will rebound and find emotional balance. Some of them are self-management, like be healthy, exercise, right amount of sleep, and nutrition and diet, and also social support, like having close friends and people to talk to is essential. Also adjust expectations and goals and pre-plan and list self-management tools.